Well, welcome everyone to our presentation webinar today. My name is Nidal Shoemaker, and I'll be facilitating this session. I do apologize for not being on video as I have some bandwidth problems and it disconnects me on Zoom when I'm on video and audio, but I want to welcome you all for joining us today. I want to also provide you with some housekeeping items ahead of time. Today's session is being recorded, and we'll share this recording, slides, and resources at the end of the training series. We would ask that you also keep yourselves on mute when not speaking to ensure that there's good sound quality throughout the presentations. If you need assistance during the call, please direct message me in the chat or Andrea Guanero, who is also our tech person. Thank you so much, Andrea. If you need assistance during the call, or if you have tech problems, she's probably the person to contact. We'll also have a Q&A session at the end, but if you have any other questions, you can enter them in the chat, and then we'll call on you, kind of playing it by ear in terms of when we can have time for some of the questions. And at the end of the session, we'll also be sharing a brief survey, and we'll ask that you all take 2 minutes to complete it. I know that everybody asks for these, but they really truly are important, and the feedback that you provide helps us make these types of webinars better in the future. So I want to thank you in advance for taking time and taking a second to do that and providing that feedback. So I'm very excited today to introduce our speakers for this series. The first person that will be speaking led our Innovation, Equity, and Exploration Work Group, identifying tribal policy through tribal leadership, is Melissa Buffalo. She is a citizen of the Meskwaki Nation, received her MS in Human Development from South Dakota State University, and has over 15 years of experience working in the public health sector in various roles. She brings a wealth of knowledge to us and to American Indian Cancer Foundation, which is who she represents. As a CEO, Melissa is committed to working with and for tribal nations, urban and rural tribal communities, with opportunities to heal emotionally, historically, spiritually, and physically from the inequities of cancer. Her responsibilities as a CEO of ACAF include the overall direction and implementation of a strategic vision to provide Indigenous cancer outcomes nationally. Our next two speakers who led a work group together are Kori Johnson and Michael Kelley. Kori serves as the Program and Engagement Manager at Safe Routes Partnership. In this role, she provides program technical assistance, leads trainings, develops resources, and supports Safe Routes to School programs and general consulting work. Michael is the policy director for BikeWalkKC. In that role, he leads the organization's efforts to advocate for the policies, plans, and projects which make it safer and easier for people to walk, roll, bike, and use public transit in the Kansas City region. Michael led a successful campaign to decriminalize jaywalking and other low-level offenses for walking and biking in Kansas City in 2021, making it one of the largest cities to take such a step. Thank you everyone again for joining us, and I'd like to turn it over to Melissa.
Thank you, Nidal, for that introduction. How midakiapi Melissa Buffalo imachiapie michincha numyunke. Kanji wakpa oyanke na meskwaki hematahan. Good afternoon, good morning from where I'm joining you from in California. My name is Melissa Buffalo. I am the CEO with the American Indian Cancer Foundation. Excited to be here with all of you to discuss our project we had. I just want to quickly share that the American Indian Cancer Foundation is located on the traditional lands of the Dakota people in Bede Ota Otunwe, our present-day city of Minneapolis. At ACAF, we strive to live out the values of balance, sustainability, respect for all living things, interrelatedness, and life ways rooted in culture. Next slide. Again, just a little bit about ACAF and the work that we do and how much that really aligns, with the American Heart Association and with Voices for Healthy Kids. So ACAF is a national nonprofit established to address the tremendous cancer inequities faced by American Indian and Alaska Natives. ACAF was founded in 2009. And again, just as a national organization, I love that our footprint continues to expand. Our goal is really to be a partner that is trusted by tribal and urban community members, leaders, healthcare providers, and others working towards effective and sustainable cancer solutions, that being Voices for Healthy Kids, one of our partners. Our staff, myself, we continue to learn from our communities, and our staff represent a handful of tribal nations across the US. Our mission is to eliminate those cancer burdens on American Indian families through education and improved access to cancer prevention, early detection, treatment, and survivor support. Next slide. Our vision really is a world where cancer is no longer the leading cause of death for American Indian, Alaska Native people. And we believe we can achieve that because we know that our Native communities have that wisdom to find those solutions to those health inequities, but oftentimes are seeking the organizational capacity, the expert input, and resources to do so. So really being there to help tribes in, serving as technical assistance providers and assisting them and meeting them where they are at and where their readiness is for the work that we want to do to help them improve their health and wellness. Next slide. Working really in partnership with tribal communities, health systems, urban communities, and others to really find ways to close those screening gaps and eliminating those cancer burdens and understanding those barriers. At ACAP, we lean on that knowledge and wisdom, again, to really help us lead and drive that work. We serve as a resource, so cancer is no longer that leading cause. And again, those strategies that we really, work to achieve is to bring attention to those burdens and those solutions, advancing capacity through training, technical assistance, and resources, and again, identifying those solutions. And why, next slide. And again, just kind of going back to, why ACAP exists and why we partner with organizations like Voices for Healthy Kids. It's because we know there's health inequities faced by Native people, whether it's cancer, other heart disease, obesity, diabetes, ACEs. So how can we really address these inequities? Next slide. Again, I feel like I've stressed this one, that we know cancer is the leading cause of death for American Indian women, and second for American Indian men, with heart disease as the leading cause. One thing that we've highlighted is that other populations have celebrated decreasing cancer mortality rates in the past 20 years. Again, this was pre-COVID, but unfortunately for American Indians, that cancer mortality rates are still on the rise. So we have never seen a decrease within this population. Next slide, please. And so just again, some more disparities I wanted to bring to everybody. Almost 33% of American Indian and Alaska Natives are obese. So again, part of the reason, why we did this project and why we think that's important to understand, work at the policy level when addressing these inequities. And American Indian and Alaska Natives have that lowest life expectancy compared to other races and ethnicities. 65 years is what the life expectancy is for American Indian Alaska Natives, compared to 77 years of age for most Americans. In 1944 was when 65 was equal to the life expectancy of the total US population in 1944. So being able to see where American Indians have not made any gains, and we still continue to lose our relatives way too early. Again, where does this align with, who I am as a Native person and the work that I do and why I do this, not only professionally, but personally? Losing my mom when she was only 56, and then we recently lost my dad and he was 71. And recently heard a pastor talking, and she was like, they say you live a good life when you hit 72. Not sure where she got the statistic, but it really just, resonated with me, and seeing where, despite my dad having been given 6 months to live, he gave us another 8. And made it to 71.4. So for me, that was just, an amazing thing versus, we could have lost him in his early 60s. Additionally, American Indians are more than twice as likely to not have health insurance coverage. And so we look at some of these health programs, right? These state programs that support uninsured, underinsured women, to get screened, to have health insurance. And so seeing where many of our relatives rely on Indian Health Service as their primary source of care, but that is not insurance. That is a government entity, an agency that, is committed to supporting American Indian Alaska health through treaties. And as we near the government shutdown, one thing to highlight within American Indians is that, despite the shutdown, the National Council on Urban Indian Health has worked with others in the government to ensure that despite a shutdown, IHS would still be able to operate. And as in the past, they were part of that shutdown. So just wanted to share that. Next slide. And so again, why this project, why we wanted to get funded to do this work and, be able to bring about some good information when working with tribal nations. So really wanting to bridge the gaps in equity and inclusion of Indigenous populations within public health and, being able to explore some of those potential solutions, from Native leaders, from those that are boots on the ground, and being able to increase the number of available tools and resources that are culturally responsive and culturally relevant, to organizations interested in partnering with tribal nations or Indigenous serving organizations. And even as, a national Native nonprofit, we still learn so much from our tribes, because there's 574. And so how we continue to learn from so many of our communities, this project also, is very close for us as well to be able to learn and being able to, look at some of those solutions. Next slide. So the project we had 5 goals, right? The first was to increase collaboration and coordination among tribal, national, state, and local stakeholders within Indian country to really lean on their understanding, right? To be able to raise awareness of Indigenous health issues and to seek influence from organizational policy that impacts Indigenous people. To develop 1 to 2 tribal policy levers around sugary tax reduction and healthy native foods. Next slide. The fourth goal was to develop and propose revisions or deletions of policy levers and policy bottom line language that is inclusive of Indigenous populations. And the last project goal was to develop and disseminate at least 1 culturally appropriate resource tool that supports the inclusion of Indigenous populations in mainstream organization efforts. Next slide. So how we did this was really, again, that assessment and hearing, firsthand from folks, being able to have a conversation. So understanding what policy implementation looks like currently within our work group members, communities, and how those efforts may or may not align with the Voices for Healthy Kids policy levers. Next slide. And, again, I think all of us, hopefully when we're, sharing our stories and, just understanding, what we all went through the pandemic and the work that we wanted to do, being funded during the pandemic with this project definitely brought, its struggles as we worked to invite at minimum 5 participants to attend 2 meetings. It was hard to get folks to want to participate in a virtual meeting. But we were able to get 5. And so in that first meeting, we really, just provided an overview and being able to review the 2021-2022 policy levers that Voices for Healthy Kids had, and, being able to give them perspective and time to really, think about those levers and how they align or do not align within their communities. And then the second meeting, we brought everyone back together to be able to have a discussion on those, open discussion, open-ended. Next slide. And so as I mentioned again, what was our priority, the activity, really looking at that sugary drink tax and investment. And, again, how does that align with tribal nations? How can this tax potentially bring more programming, more health and wellness to the community? And where's the priority that fits in as we think about not only the pandemic having a role in our tribal communities, but for all of us, as well as what are the priorities of the tribe and the health department, water access and school food access and dietary quality as well. And so looking at that and kind of where those conversations brought us, had a talking circle and really brought in our culture to have conversations with those 5 individuals. And again, I think, during the pandemic and all these conversations and trying to bring folks together virtually, I don't know that we were able to get where we wanted to. We were able to close out this project and we did create 1 resource, from all of what was shared within those 2 meetings and a talking circle. But, really being thankful to the work that we did with Nadan, being able to keep her, close to the conversations and where the project was, and to be able to lean on her support and her guidance as well. Next slide. And so as we, looked at those levers and being able to align or not align those works, what was the importance of, values and culture in the community? And again, understanding mainstreams, organizations, understanding of time, apparently time twice, and relationships. And so how we brought that into the conversation and how it really helped us to see the outcomes of this work. And so from there, we did create one resource. It is on the website. I will throw the link in the chat afterwards, but I have 2 more slides if you want to go to those. Again, the resource we were able to create is this beautiful booklet, identifying tribal policy through tribal leadership, innovation, equity, inclusion. And again, just kind of gave an overview, of Indigenous values, understanding the importance of trying to meet tribes where they're at, and understanding what, is priority for them when coming in and wanting to work with tribal communities and wanting to do it in the best way. Next slide. And being able to understand also that, tribes are sovereign nations and that they are their own government entity. And so when we look at that nation to nation relationship with the government, being able to bring that into play and what role that does play. And who doesn't love to see their child in a resource? So we're able to pull some of our pictures from our Powwow for Hope, which is our annual community healing event, and bring those pictures into this resource. And with that, I want to again thank the Voices for Healthy Kids. I want to thank Nadan, all of the other staff that were, helpful in, allowing us to have this project and being able to bring this resource, into reality, and being able to hopefully see it as a resource for all of you. With that, Kitabi Pidamayai. Yay. I will link the resource again, and there's our website, and please reach out to me if you have any questions. Thank you.
Thank you so much, Melissa, for sharing that information and about the work that you did, and during a really, really difficult time of the pandemic, which had its own set of challenges, as you mentioned. Does anybody have any quick questions for Melissa? Did that just come to mind immediately? Okay. Well, if you do come up with some, please feel free to put them in the chat, or we'll have a little, hopefully a few minutes at the end of the call as well. So I'd like to now turn it over to Kori and Michael.
Good afternoon or good morning to wherever you may be. Again, my name is Michael Kelley, and I'm joined by Kori Johnson from Safe Routes Partnership. And we're here to talk with you a little bit about our work group, which explored aspects of racialized traffic enforcement and how to take on unjust traffic laws. Next slide. So this is a very, very quick rundown of what we'll be talking about in terms of background, why the work group, some of the big accomplishments of the group, and where we go from here. Next slide. So a little bit of background about efforts to decriminalize racialized traffic enforcement. Next slide. So when we're talking about the idea of racialized traffic enforcement, it really begins with this idea of over-policing the free movement of Black and Indigenous people of color. This can include, but isn't limited to, aspects of ticketing, unnecessary stops, elements which all contribute to both the perception and reality that certain users of our transportation system are over-policed more than their white counterparts. When we talk about much of what this has been in the past, a lot of this has centered on instances of driving. And so the phenomenon of driving while Black has become a natural part of the lexicon, but that has slowly changed over time with instances and cases like the shooting death of Michael Brown in Ferguson, which began from a dispute over a jaywalking ticket. A broader understanding of how we're over-policing mobility, not just driving alone, has begun to emerge in both our understanding and our research around those issues. The bottom line is that it doesn't contribute to safer outcomes. We have consistently seen increases in both pedestrian and cyclist crashes, serious injuries, and fatalities over the last few years. And despite the number of tickets remaining relatively steady, that number of deaths and injuries has continued to increase, primarily for Black and Indigenous people of color. And so it is important for us to understand that while there are elements of traffic safety that absolutely need to change, we need to look with a much more critical eye towards the enforcement portions of our transportation system and really ask, is this actually contributing to safer outcomes? Next slide. So the kind of critical report that really got the ball rolling on understanding why traffic enforcement as it relates to people outside of a car is such a big deal was the Walking While Black report produced in 2017 as a joint venture between ProPublica and the Florida Times Union. What it essentially showed is that Black people made up 29% of the population in Florida, but were receiving about 66% of the traffic tickets there for pedestrian-related violations. And so there was a clear disparity in who was receiving the tickets and who was actually being harmed by the current transportation system. So in addition to the increasing amount of tickets, the number of pedestrian deaths continued to increase every year from 2012 to 2016 in Jacksonville. Beyond the tickets and the deaths themselves, there was also a financial component to this, which was that people were receiving these tickets and fines that ultimately ballooned to the point that people were losing their licenses altogether. Next slide. And so that gets us to the question of, why is jaywalking even a thing? And the answer is that it actually begins with driving. So jay driving, which is kind of the precursor to jaywalking, actually has its roots in Kansas City. The first mention of either term was actually in an October 1905 edition of the Kansas City Star. And at that time, jay was a slang term used to describe someone as a hick or an idiot, basically to describe, in this context, someone who did not know how to navigate an urban area. You had a number of people flocking to urban areas at the turn of the century, and people were trying to navigate streets with cars, something that had not existed in many places up to this point. And so as part of this, there began to be an increase in crashes at a very alarming rate. And there was at one point a considerable push by residents to significantly restrict cars in urban areas. This alarmed car companies. And so as a result, they mounted a PR campaign that began to shift the blame to pedestrians and other users outside of a car. Unfortunately, that PR campaign was so successful that it actually convinced city leaders to begin adopting jaywalking laws. And so in places where jaywalking was not only legal, but expected for much of a city's history, you now had laws specifically saying that you could not operate in that way, which not only dramatically changed the paradigm around traffic safety and our understanding of it, but also contributed to an increase in policing and over-policing of Black, Indigenous, and other minority communities. Next slide. And so all of this kind of culminates in what ultimately happened in Kansas City with BikeWalkKC. So following the death of George Floyd in 2020, there were protests around his death. And as a response to that, the KC-Mo City Council adopted Resolution 200450. Essentially, what the resolution said was that the city staff need to work to find legislation, policies, regulations, rules, which may lead to unfair treatment for certain segments of the population. BikeWalkKC used that to review the municipal code, basically saying, okay, if you're going to apply this all over the place, let's specifically apply this for walking, biking, active transportation. And so as part of our analysis, we identified portions of the municipal code and eventually got to the point where we would ask one of two questions of laws that looked questionable. One, can they be enforced equitably? And two, can they contribute to safer outcomes for vulnerable road users? If the answer to both questions was no, then it stood out as a law that probably needed to be changed. We ultimately identified 3 laws: jaywalking, bike inspections by police, and dirty wheels, and pushed for changes. So in 2021, we were successful in getting jaywalking and bike inspections repealed and significantly modifying the section on dirty wheels. Next slide. So I'm going to turn things over to Kori to talk a little bit more about the work group.
Thanks, Michael. Yeah, so Michael kind of gave the background and laid out the foundation and the story behind how we came to this place working with Voices for Healthy Kids to start this working group about repealing traffic laws. So I'll talk a bit about the purpose, structure, and members of the work group. And actually, before I move on, Michael, I see a question in the chat about dirty wheels and what that means. Do you want to explain really quickly?
Yes. So dirty wheels is a law that basically says you cannot operate a vehicle with dirt, grime, or some other foreign substance on city streets. So if there's bad snow or if you drive by a mud puddle, you could theoretically be in violation of the law.
Thanks, Michael. Next slide, please. So basically, following the success of, repealing jaywalking in Kansas City, BikeWalkKC, Michael's organization, connected with my organization, Safe Routes Partnership, and we're a national organization that works to advance safe walking and rolling. And so we're really interested in, kind of like capturing that story and elevating it with a wider audience. So we partnered together to develop a how-to guide all about how to decriminalize mobility and how to help other communities repeal traffic laws like jaywalking or dirty wheels or inspections and other laws that lead to racialized enforcement. So we worked together for several months to develop a resource taking on traffic laws, a how-to guide for decriminalizing mobility, and really wanted to help advocates be able to take those next steps to do the same thing in their communities. So we launched that resource and held a accompanying webinar all about this resource. We had a lot of interest. There were like 300 people who attended this webinar. So lots of interest and intrigue about what it means to repeal traffic laws. What does this look like from an advocacy angle, from a legal angle, and people who really want to think about how to do this work in their own communities. So we had attendees from all across the country, from many different professional backgrounds and a variety of different communities. And, people definitely got a lot out of the experience in Kansas City. And we also, as a result of that webinar, we also started to gather some additional insights about how students specifically are facing are facing similar challenges when they're walking and biking and rolling to school. So thinking about how racialized enforcement is not only impacting adults, but also young people. And also that wasn't just included, also, like that issue wasn't just, limited to, interactions with police and law enforcement. It was also things like poor sidewalk quality, stray dogs, perceptions and experiences with violence. So all of this is kind of, impacting students on a deep level as well. So not just adults. Next slide, please. So we also realized following that webinar that while there was a lot of interest and, an energy around this movement to repeal traffic laws and decriminalize mobility, we also got a lot of questions. And what we kind of found is that after the webinar, people are reaching out to us saying like, oh, Kansas City, this example is so inspiring. It's really interesting, but my community might not be there yet. So there are lots of questions about, how do you build a coalition of support? How do you work with elected officials? How do you determine what legal steps to take if you want to start an advocacy campaign around repealing traffic laws? So there were some communities that weren't quite at the level that Kansas City was at when they started their process, and we realized that we might need to take a few steps back and start, really from the very first step. What does this work look like? We also had some people asking questions about, the correlation between jaywalking and safety. And this comes up a lot when we talk about student travel, but also just travel in general. So we might mention, community might want to take steps to repeal a jaywalking law. And some of the first questions that are asked is, that'll make the street unsafe. If there are kids who are crossing in the middle of the road, it creates an unsafe situation, and the jaywalking laws really do keep us safe. Even though, Michael just, kind of talked a little bit about how that's actually not the case. And so, we kind of needed to take a few steps back and think about how we talk about jaywalking and safety, and giving some basic information so that people know that, jaywalking laws aren't actually helping keep us safe. And there are other things we can do to ensure that streets are safer, whether it's better infrastructure or education around safe walking, biking, rolling, and driving, public public messaging campaigns, and other ways to enhance safety besides having jaywalking laws that lead to racialized enforcement. So basically, we knew that we need to do some additional work here. We have a group that is energized and curious and wants to move this work forward, but we need to, kind of put some other structures in place to support that process. And so, we decided that some sort of, hands-on training or some sort of convening would be the most effective way of helping advocates move their work forward, and also provide a forum for us to answer some of these questions that were coming up following the resource we published with BikeWalkKC. Next slide, please. So basically, we received funding from Voices for Healthy Kids to convene a national working group to really focus on this issue around decriminalizing mobility and breaking down barriers that that lead to racialized enforcement. And so we were able to put together a working group and provide stipends for people to participate in this working group to really kind of dig into like, what does it mean to start and implement an advocacy campaign around repealing traffic laws? What does that look like? How do you get started? And so we decided to kind of build this working group based on the lessons taught, the lessons that we learned from launching the how-to guide, which is basically that communities want to do this work. They just need a little more help and a little more support. And we need to start a few steps back from where that original guide started. So that's how we, decided to create a working group. And if you go to the next slide, I'll talk a bit about what we were looking for when we put that group together. So we knew that we were looking for, we didn't want all the working group members to be the same. So different parts of the country, different backgrounds, different lived experiences. We wanted that to really make up the working group that we put together. So when we were, kind of thinking about who would be a part of this, we, kind of had a few different considerations in mind. The first one is just having racial diversity. So inviting people to be in the group who, had racially diverse backgrounds, who could speak to their own lived experiences, both personally and professionally. That was really important, especially for a topic like this. We're talking about racialized enforcement. Having that racially diverse working group was really important to us. The second was geographic diversity. So we also know that this work looks different in different places. And we didn't just want people on, large or progressive coastal cities to be represented to be representing the entire group. So we needed people from across the country, whether that was people in big cities, smaller towns, people working in smaller nonprofits or county governments. We wanted like a nice range of people. And that also really meant focusing more on, Midwest, Southeast, and our mountain regions. And then lastly, just that lived and professional experience. So again, knowing that people bring their own experiences to this work and being able to, share their own background and experiences and expertise, that was a big part of this work as well. So we wanted to identify people who were able to speak on a personal and professional level about how racialized enforcement impacts their work and their lives. So that's a bit about us forming the working group. And then if you go to the next slide, so this is our member organization roster. So our working group members were coming from these organizations. So we had people from, Pittsburgh, Knoxville, Tennessee, Atlanta, Denver, Hawaii, LA, the Policing Project, which is run out of NYU. We had a representative from NACDO, which was really great. People working in Washington State, in Tacoma, in California at UC Davis, and then the Washington Area Bicyclist Association, kind of representing the DC Metro Mid-Atlantic region. So we had a really great group. And again, this is a group that's comprised of people who have backgrounds in nonprofit management and advocacy. Somebody is actually a former DC police officer who now does work on police reform. Like a lot of local advocates, people who are kind of working in this transportation space through an advocacy angle. So I'm just a professor who was able to talk to us about, like some of the data and research behind racialized enforcement. So a great group all around and really diverse, both racially, geographically, and professionally. Next slide, please.
Yep. So I can jump back in here. And
Yep.
so the idea with all that taken care of, the idea was then to get to work. So next slide. So we've covered several topics as part of this, and I'll go through this kind of quickly. So the first one was legal elements. So when it came to pushing for changes, the need for legal expertise was paramount. And the reason for this is because we are oftentimes dealing with not just laws on the books, but also policies, rules, regulations that may create different types of changes that are necessary and help you and necessitate speaking with different sorts of groups to get the sort of changes that you want. For this topic, we actually brought in Ruth Ann French Hodson. She is a lawyer by trade, and she also serves on BikeWalkKC's board of directors. When we were working to decriminalize walking and biking, Ruth Ann actually penned a legal memo for members of the city council to help them understand why changes to traffic laws like this wouldn't be a bad issue from a legal standpoint. One quick thing I want to note here is the issue of preemption. So preemption is basically where a higher jurisdiction exerts control over a lower jurisdiction. We typically see this at national and state levels, but when it comes to issues around jaywalking, we have increasingly seen this at state and local levels. One place where we saw this play out among our work group is in Atlanta with Civil Bikes. Atlanta has several organizations that support the idea of decriminalizing jaywalking. But the problem is that the law related to jaywalking is largely driven by the Georgia state legislature, no pun intended. And so the idea was that the state is preempting the local jurisdiction, Atlanta, when it comes to the issue of jaywalking because they have control over that specific law. Next slide. Another element, as Kori alluded to earlier, was the issue of data. So when we did this portion of our work group, we invited Dr. Jesus Barajas to come and talk to us about his research. So Dr. Barajas has done research around tickets and whether or not they contribute to safer outcomes for cyclists in Chicago. And how he was able to do that was by getting data from the Chicago Police Department. And so a big focus of his work and what he talked about in his presentation for the rest of us was an emphasis on the specificity of records. If we're trying to get a full and complete picture of the problem, of the disparities, that requires being as specific as possible in making your requests to the entity that has that data available. So that would be asking for things such as the location of tickets, the race of the people who are involved, whether they were walking or biking, and other elements that can help you to get a clear picture to not only better understand the issue, but then present that as part of a compelling argument to get a change made to the law that you've identified. Next slide. Another part of this was coalitions. Nothing happens because of one person or one group. It is very much a result of a coalition of people working together. How do you get people to care? Oftentimes you have to specifically tie the issue you're working on to an issue that matters to someone else. When we were working in Kansas City, one of the ways that we got sustainability groups to sign on was arguing that transportation is our largest source of greenhouse gas emissions for our region. We cannot ask people to engage in greener, cleaner forms of transportation like walking and biking without also breaking down the barriers which make that unsafe. It is not just about infrastructure, but also about issues related to safety as it relates to dealing with law enforcement. who should be part of your coalition. This is really important to have kind of a broad coalition to not only demonstrate support to different parts of the city council that may listen to different parts of the community, but also to the public to show that this isn't just something that the active transportation advocacy folks are asking for. Final part is, how do you work well with partners? A lot of it revolves around making small, simple, specific asks. Can you submit a letter of support? Can you submit some public testimony? Can you show up to speak at this public meeting? And keeping people updated about those elements as they go is really important to keep people engaged and have their support throughout the process. Next slide. The final big topic we discussed was communications. And so with regards to the key message, the idea is, can you figure out one key element you want people to understand? There are multiple benefits to decriminalizing mobility, but what is the biggest message, the most important message that you want to convey to your main audience? Who should be the main messenger? An additional way to build familiarity, but also add some level of structure to the group that you are working with is to have a main messenger. This person can be a spokesperson for the coalition, can answer questions, and can establish the rapport with media and others that gives an air of legitimacy to a change that oftentimes can be seen as controversial. Finally, where to focus the messaging efforts? It is largely going back to the coalition, trying to be strategic in a way that not only gets the attention of decision makers, but gets their attention in a way that forces them to make a decision one way or the other when it comes to your issue. Next slide. So there were several organizations that were actually taking steps during our work group to try to decriminalize mobility. And the one that we want to highlight here is Denver, led by the Denver Bicycle Lobby and Alan Cowgill. They did something a little bit unique compared to other communities we've seen. They drafted a report on jaywalking. And what you're seeing here in the background is an image from that report. Basically, Denver was able to take all of the jaywalking tickets they had and overlay them over their city's high injury network, which is basically a collection of data that shows where in your street network crashes, injuries, and fatalities are concentrated. They were able to find that these crashes, that these corridors, the high injury corridors, also correlated with where a lot of the jaywalking tickets were being given out. So the argument was specifically that we are giving out tickets to people who are being forced to navigate spaces that were not designed for them in the first place. And that is not only putting them at risk of tickets, it's literally putting them at risk of death. And so being able to show this very stark, clear picture of why jaywalking was not working ultimately helped them to build a coalition and push for a change that led to the Denver City Council ultimately decriminalizing jaywalking in January of this year. And that is a direct result of the work with the Safe Routes Partnership, as well as the support from Voices for Healthy Kids. Next slide. Back over to you, Kori.
And support from Michael at BikeWalkKC, because I know that you were definitely in touch with Alan about how to do all this work. So yeah, thanks for your help on that one too, Michael. So just a few next steps, just talk about, concluding the group and what's on the horizon for us. Next steps. Sorry, next slide, please. So as a result of the working group, and we started the working group back in December, and we just wrapped up in June. So over the course of a few months, we were able to take all of those great topics we talked about and put together a new resource to complement the how-to guide that we published originally with BikeWalkKC. So this new resource is an advocacy guide that really goes a few steps back and talks about how to set up your policy campaign for success. So some of the topics that Michael mentioned, how to start a coalition, what does messaging look like? How do you find a spokesperson? How do you include social media in your campaign? All of those things we put into this new resource that really gives advocates, an organization, kind of like those 101 steps for really kicking off your policy campaign. And it covers a lot of the topics from the work group, along with some of the, case studies and examples, Denver being one of them, and really just kind of like lays out that foundation that you can then use to get to the next steps where you might be ready to use the how-to guide that we published as well. Next slide, please. And then lastly, we just wanted to let you all know about some ongoing campaigns from across the country where different states are really working on repealing traffic laws. So in Washington State, the Transportation Choices Coalition launched a campaign to basically persuade the Washington State legislature to decriminalize jaywalking. They were successful in getting the bill introduced, but were not able to make it out of committee before the end of session. But advocates are still working to, build that support and are meeting with legislators and researchers, to kind of figure out what change, what changes they might need to make, and really kind of, continuing to make the case for why they need to repeal jaywalking across Washington State, and are really looking at like other examples from other places that have done this successfully to make the case why it can also be successful and happen in Washington State, and also keep people safe while walking, biking, and rolling. So that's Washington State. So Hawaii is kind of like a bit of an outlier. So the push to make changes in Hawaii came from a legislator rather than a local advocate. Usually it's like the reverse. And so one of the state senators introduced a pedestrian decriminalization bill, and other partners at Hawaii's coalition, Safe Routes Coalition, kind of followed and supported that measure. But that also failed to pass. And so they're basically trying to work with Senator Rhodes and some other legislators and community advocates to push that work forward and introduce a bill in their next legislative session. And then also DC, so I guess kind of like, a city that's like a state but isn't really a state, also have their own campaign to remove traffic enforcement, to remove police from traffic enforcement, and that's led by the Washington Area Bicyclists Association, which is a local advocacy group that works across the DC metro region. And so they've been working on their efforts to not necessarily repeal traffic laws, but think about different ways that basically looking at ways to remove police officers from traffic enforcement. So that's what's happening in the nation's capital. And I think that is our last slide, if I'm not mistaken. So, Michael and I are here to, answer any questions that you all have, either now or after the session. And we just thank you all for your time. Next slide, please. Yep, so it's questions if anybody has questions, comments.
Yeah, thank you so much to Michael and Kori as well for their great presentation. Also, does anybody have any questions? Please raise your hand if you do. And if you, I also want to let you know that Andrea is going to be launching that small poll before here, right there it is. So if you could quickly click on that, because you can still hear us even while you're working on the survey. But does anybody have any questions or even comments regarding the presentation or Melissa's presentation?
I was going to say, I think Logan has his hand
Oh,
up.
Logan.
Sorry, I'm filling out the questionnaire, so I should have lowered my hand before I did that. So I've got a question for Melissa, and then I also have a question about the pedestrian advocacy. Melissa, were you able to identify any, I guess, like I said in the chat, but consistencies across the groups that you studied and worked with on any factors that jumped out at you to contribute to the poor health determinants?
I don't know that I mean, yes and no. I was thinking about my answer, what I shared from the report. I think because we kind of already know some of those, right? That it just kind of went more into those policy levers. I think when we think about some of those inequities and barriers, we think about historical trauma, access to care, medical racism, medical mistrust are some of the things that, the conversations we've had, but I don't know that those came in specifically into the talking circles or the work group meetings.
Okay. I work for an environmental public health group, and we've been studying a lot of cancer and asthma and health associated issues with Pennsylvania's fracking and oil and gas industry, petrochemical facilities. People who live around there have shorter life expectancies and just a host of health issues that other people don't experience. So I didn't know if you were able to identify anything along those lines. But you know, we're working on trying to identify that in Pennsylvania and maybe future litigation around that. So.
Yeah, I think that's a topic ACAF is starting to have conversations about, but we haven't had any project specific as we think about environmental impacts, but we definitely know they're there, especially think about the melting in Alaska and impact that's had on even like fishing and food and gathering whatnot for the villages up that way. But
All
yeah,
right.
I think that's something to
Well,
think about in the future.
yeah, feel free to reach out to me if you want to talk about any cross
Okay.
stuff.
Yes. If you want to put your email in the chat, that would be great.
Yeah, sure.
Okay.
And then for the transportation people, pedestrian people, we have a group, Feet First Philly, that we started from Clean Air Council. And we have really been pushing for pedestrian safety. And there is a lot of preemption in Pennsylvania on pedestrian issues. So this was really helpful. And I would love to connect you guys to our Feet First Philly group if you haven't already spoken with them. And the Bicycle Coalition is also a big partner of ours because of mostly because of the preemption issues. You know, some states have constitutional rights to some of these issues, and I'm wondering, have you thought about that in terms of legislation pushing those in the states that you've been working with? So for example, Pennsylvania has a right to a clean and healthy environment. And one could argue that a healthy environment means getting out and being able to walk safely in your communities. And we've been discussing how far we could push that without it getting kind of a laugh from the judicial branch. You know, we don't want to ruin what we have, but we also want to protect pedestrians in our communities.
Sure. Well, I can jump in first, and then if Kori has additional thoughts, she's welcome to jump in too. I think with the constitutional element, we kind of got into that, and we were talking with Ruth Ann about the legal elements of it. I think the reason why we didn't decide to pursue a judicial route is really because it was a matter of capacity. Like, I think that for us and for many organizations, probably yours as well, we don't have the resources to be able to pursue something through the courts. We're still trying to figure out how we want to pursue some of these changes at the state level, and so it's not that we don't think that it wouldn't work. It's just that we've never really had the ability to go after that amount. But I will say that, you know, given some of the recent rulings, especially the one in Montana about a right to clean air and things of that nature, it doesn't necessarily strike me as impossible that you could make a similar argument for pedestrian safety.
Yeah, and I think another thing that came out of the working group was really talking about, you know, like changing the narrative around safety and jaywalking and what it means to be safe and who gets to define what safe and safety is. So we had a lot of conversations, you know, similar to what Michael mentioned, talking about how, like, if you actually look at the data, that, you know, that jaywalking is not what's creating, you know, unsafe streets. It's, you know, whether it's, you know, poor road design or just the way that we're planning and structuring, you know, our neighborhoods and, you know, and cities. So that was also a large part of this. So, you know, it's definitely, you know, kind of like the, you know, like the legal avenues that you can pursue, but then also just talking about just like general messaging around, you know, safety and how we move across our communities is also a big part of this. And so I think that in the resource that we put together, there are also just some great tips about, you know, how do you just talk to community members about these topics, about jaywalking, about repealing traffic laws, about racialized enforcement? How do you start those conversations? What do they look like? You know, like what are some, you know, prompts that you can use or words that you can use to really change the narrative around, you know, what it means to be safe. And how safety is such an individual experience sometimes, but oftentimes there are groups of people whose perceptions of safety are amplified more than others. So how can we start to shift some of those narratives? So that was also a part of the working group conversations that we had.
Thanks. And I emailed Nick, our transportation person who's in charge of Feet First Philly, your your emails, so hopefully you guys can connect.
Awesome.
Okay.
Thank you.
Thank you.
Thank you, everyone. I see that Anne had a question that Michael already had answered, but it was around our laws prohibiting jaywalking in most states. And Michael, your short answer was yes, but it might not be listed as jaywalking. It could be under disguised as something else or something else in another piece of legislation. Or
Yes. So really quick to just add on to that, when we were pushing for the change in KCMO, there was no listed law around jaywalking. What you will oftentimes see for jaywalking laws is something related to pedestrians shall not cross somewhere outside of a median. That's a jaywalking law. Or if you're like not allowed to walk in the street irresponsibly, that is also related to kind of the spectrum of laws related to jaywalking. So some places do explicitly say no jaywalking and then go in to define it, and then there are other places that have what essentially amounts to no jaywalking, but they never specifically use that term. So that's the reason why I can't give you a specific like number or volume, is because how that is defined and how that is written varies considerably from state to state.
thanks so much. And last, we only have a minute or two left, but I want to give a chance. I see Nigel also provided some information based on Melissa's presentation, I believe, where he's talking about due to traditional indigenous foods being taken away and replaced with unhealthy government commodity foods, and the USDA food guidelines and capitalism making it more profitable to sell bad food than healthy. And yes, we could go on and on about that, Nigel, but Nigel or Melissa, did you want to comment to that very quickly? We have like 1 minute left.
Yeah, when Logan asked the question, I was just gonna type one word, racism, but I figure we can expand on it a little bit. And then Melissa did a great job with medical racism, among others. So good job, Melissa. Thank you very much. I love both presentations.
Thank you so much. If you have additional questions, please feel free to email any of these that you're seeing on here, the email addresses, or to me, and I will make sure that the appropriate person will get the email and I'll connect you if you don't have them down. We'll also be sending out the presentations to you in follow-up, so you'll have those as well. I want to thank everybody for your questions. I want to thank everybody for the presentations. Great job. Thank you so much. Bye-bye.
Thanks, everyone.